Hello, my name is Hugo Puentes, and in this presentation, I'll be discussing radiation therapy. I'll explain how it works, the two main types of radiation treatment, the emotional impact it can have on both patients and their family, and why it's important to treat the whole person and not just the disease. Radiation therapy treats cancer by sending intense energy into cancer cells, damaging their DNA so that it will stop replicating. Over time, those cells die off and the body naturally removes them. You can think of it like a precision strike that targets the tumor while limiting harm to healthy areas around it. There are two main ways this treatment can be given. One is called external beam radiation, where a machine outside the body directs the energy towards the cancer. This is the most commonly used type, and you'll see a picture of that in my slide right here and this one over here. The other one is known as internal radiation, or also as brachytherapy, where a small radioactive source is placed close to or inside the tumor. I do not have a picture of that in my presentation because it is not used as often as external beam therapy, but it can also be very effective depending on the type and location of the tumor. This type of treatment is powerful and precise, and it is designed to meet each of the patient's individual needs. But while radiation therapy affects the body physically, it can also take a toll emotionally. Patients often feel overwhelmed, anxious, or exhausted. These emotional responses are common during their treatment. But it's not just the patient who is affected, family members can experience high levels of stress, fear, and emotional exhaustion, as well as watching a loved one go through cancer treatment can bring feelings of helplessness, uncertainty. That's why it's so important to support not only the patient but also their support system. Research shows that offering emotional support, encouraging open communication, and providing access to mental health can help ease this burden. When patients' families feel supported, it improves their emotional well being and may even lead to better treatment outcomes. In conclusion, radiation therapy is a critical tool in the fight against cancer. It works by targeting destroying cells using either external or internal methods, but it's most effective when we remember to treat the whole person and recognize the emotional needs of both patients and their family. When care is compassionate and comprehensive, healing becomes a little easier for everyone involved in the process of the patient's treatment.